Good day, everyone. I'm Ian Grace Mayorga from Cavite State University Main Campus, and I'm going to show you the implementation of the procedure of the Oropharyngeal and Nasopharyngeal suctioning as my return demonstration. So first is what is the purpose of suctioning. So suctioning clears mucus from the tracheostomy tube, and it is essential for proper breathing. So when it is the right time to do suctioning. So we need to do the suctioning to remove the mucus or saliva from the back of the throat if the patient or the client cannot cough or swallow. So let's start with the return demonstration. First procedure is we need to gather the supplies. The next is we need to perform the following safety steps. First is to check the room for transmission-based precautions. Okay. The next is we need to perform hand hygiene. And as a student nurse, we really need to do introducing ourselves with the client. So, good morning, sir. I'm Ian Grace Mayorga po from Cavite State University Main Campus. And I am going to be your student nurse for today po. So, what's your name po, sir? Okay. So, ilang taon na po kayo? Kailan po ang birthday nyo? Okay. So today po, sir, as we are implementing the oropharyngeal and nasopharyngeal suctioning procedure, I have here the suction catheter, and we need to insert it in your nasal cavity to your pharynx and into your oral cavity to your pharynx then po to complete the procedure. Would that be okay with you po? Okay. So as you can see, I already did the confirming the patient using the two identifiers, specifically her name or his name and the birth date. And also I already did the explanation of the process to the client. Next procedure is we need to be organized and systematic. As you can see, all the materials gathered here in one place, and it is organized from where it should be placed as well. And as a student nurse, we should have the therapeutic communication skills, which will be used to use inappropriate listening and questioning skills with the client. So, ma'am, are you comfortable po with the implementation of the procedure? Okay. And if you're not comfortable po, you are free to say what you feel and what you need all throughout the procedure po. The next is we need to ensure the client's privacy. As you can see, the curtains and the doors were closed, and all the data that will be gathered in today's procedure will be kept confidential. The next is we need to adjust the bed to a comfortable working height and lower the side rail closest to me. And then we need to position the patient, and as you can see, my patient is conscious, and I'm going to position him in a semi-Fowler's position. okay, sir? You're comfortable? The next is we need to move the bedside table close to the working area and raise it to the waist height. Then we need to place a towel or waterproof pad across the patient's chest. Since my client belongs to the adult or adolescent period, we need to adjust the suction in no more than 150 millimeter mercury. And then we need to put on a clean glove and occlude the end of the connection tubing to check the suction pressure. Then next, we need to place the connecting tubing in a convenient location. Example is at the head of the bed. And we need to open the sterile suction package using aseptic technique. We need to place a small amount of water-soluble lubricant on the sterile field, taking care to avoid touching the sterile field with the lubricant package. And then we need to increase the patient's supplemental oxygen level or apply supplemental oxygen per facility policy or primary care provider order. The next is we need to don additional PPE or put on face shield or goggles or face mask. And then we need to don sterile gloves. After donning sterile gloves, the dominant hand will manipulate the catheter and must remain sterile, and the non-dominant hand is considered clean rather than sterile and will control the suction valve on the catheter. And we need to moisten the catheter by dipping it into the container of sterile saline. Occlude the suction valve on the catheter to check for suction. free my fingers to help advance it and advance the catheter approximately 5 to 6 inches to reach the valves. And for the oropharyngeal suctioning, we need to insert the catheter through the mouth along the side of the mouth toward the trachea. And advance the catheter 3 to 4 inches to reach the pharynx. And then we need to apply the suction by intermittently occluding the suction valve on the catheter with the thumb of my non-dominant hand and continuously rotate the catheter as it is being withdrawn. And then suction only on withdrawal and do not suction for more than 10 to 15 seconds at a time to minimize tissue trauma. Then we need to replace the oxygen delivery device using my non-dominant. And then we need to replace the oxygen delivery device using the non-dominant hand if appropriate and allow the patient to take several deep breaths. And then flush the catheter with saline. And then assess the effectiveness of the suctioning by listening to lung sounds and repeat as needed. And then assess the effectiveness of suctioning by listening to lung sounds and repeat as needed and according to the patient's tolerance. When suctioning is completed, we need to remove the gloves from the dominant hand over the coiled catheter. Pulling them off inside and out. And then remove the glove from the non-dominant hand and dispose of gloves, catheter, and the container with solution in the appropriate receptacle. And then we need to assist the patient to a comfortable position, raise the bed rail, and place the bed in the lowest position. And then turn off the suction and remove the supplemental oxygen placed for suctioning if appropriate. And then we need to remove the face shields or goggles and face mask and perform hand hygiene. And then we need to reassess the patient's respiratory status, including the respiratory rate, effort, oxygen saturation, and lung sounds. And then assist the patient to a comfortable position and ask if they have any questions and thank them for their time. The next is we need to ensure the safety measures when leaving the room. First is the call light. We need to put this within the reach of the client. And then the bed, low and locked. And the side rail secured. And the room risk-free for falls. And then free from any obstacles. And then perform hand hygiene. And document the procedure and related assessment findings. Also, we need to report any concerns according to agency policy. And that's all for this return demonstration.